So occupational safety, those who have the textbook, please mention the page number in the chat box. Yeah, and if anyone is joining late, please help them out with the page numbers. So occupational safety in health, it should aim at the promotion and maintenance of highest degree of physical, mental, social well-being of the workers of the healthcare organization. So this is what the definition of occupational safety in terms of healthcare or hospitals aims at. Okay, it covers all the safety guidelines, the protection equipments, regulations, protocols you have to follow, list of hazards and how to tackle them. Okay, how to improve the health of the employees, how to insure them from any health related damages. Okay, all this comes under work safety, occupational safety. Hospitals as well as other medical facilities have occupational hazards, very similar, and there are also risks that are very unique to healthcare environment as well. And after COVID-19, we have seen the emphasis on the importance of emergency responses system, building capacity in healthcare system, staff capacity, and also the role of healthcare professionals in managing any viral infections or outbreaks. Okay, after COVID, we have learned this lesson. So public health emergency has placed all functions under scrutiny, and the procedures to control and mitigate the risk and hazards have gathered pace. As healthcare extends into community and home environments, hazards and risk to healthcare workers increase manifold because these risks they can carry to their own house as well and thus into the community. So it does not stay only till the hospital or healthcare organization, it can spread into the community as well from the hospitals. So occupational environment is the interaction of man, physical, chemical, biological environment. Okay, man with man, man and machine. So man, the workers, the employees are interacting with these three areas. Okay, biological, physical, chemical, other people, that is man and man, man and machinery. Okay, in biological and reproductive hazards, chemical, physical, biological hazards, okay, exposure to bloodborne pathogens, infection agents, diseases, any musculoskeletal injuries, cuts, lacerations, concussions, and along with needle stick injuries. And the reproductive hazards can also include radiations, chemotherapy, therapy agents used, okay, video display terminals, okay, shift work. Chemical hazards can include disinfectants, can arise from disinfectants, sterilizing agents, solvents, okay, like alcohol, acetone, anesthetic agents, chemotherapy drugs, detergents, tissue fixatives, reagents. These all are chemicals that can lead to hazards. Physical hazards like exposure to needles and other sharps, ionizing as well as non-ionizing radiations, electrical hazards, compressed gases, noise, extremes of temperatures, repetitive strain or motion could lead to musculoskeletal injuries. Okay, so these are the different examples of hazards in healthcare sector. Man and man, it's physical violence. Okay, man and machinery, if we'll discuss about certain man and machinery related occupational hazards. So potential hazards in administrative departments, offices, it's usually musculoskeletal injuries. Okay, usually the potential hazards that we see in all the administrative sectors where clinical work is not done, only administrative work and non-clinical work is done. So employees sit on their desk for a very long period of time without moving. Okay, that could lead to like stiffness. Okay, any sedentary lifestyle disease, related diseases. Okay, eye vision or eyesight can diminish if they're continuously straining and looking into the computer screens. Okay, so in every hour, at least 5 minutes break they have to take. They have to blink continuously for 5 minutes so that the eyes get rehydrated. Okay, they can have a small break in between. Every 1 hour, they have to get up from their desk and walk for 10 minutes and then come back and sit. So if they do these kind of exercises while working, while even being on a sedentary desk job, it is better. Okay, you can improve the health. So this is one of the examples of potential hazards that can take place in the administrative offices. Coming to the CSSD, Central Sterile Supply Departments, in here, risk of infection, okay, risk of transmission of infection, outbreak, okay, outbreak can take place through the CSSD as well. If the equipments are not cleaned properly or sterilized or disinfected properly, they could be a pathogenic source as well. In CSSD, if ethylene oxide, these kind of gases are used, that would lead to employee health injury, okay, respiratory issues in employees. Um, if the equipments are dysfunctional, okay, if there is an electric short circuit, that could lead to issues with the autoclave or hotter oven, and the staff could also get staffs could also get injured. Okay, usually if the CSST has ETO, ethylene oxide chamber, this is how it may affect it. It's a toxic gas. Toxic gas is used here. Toxic reagents or disinfectants used here. Even enzymatic cleansers, if it is used in CSST, these are also harmful on employees' tissues. Okay, if the employee is exposed to enzymatic cleansers, okay, it will harm their soft tissues as well. So that's one example in CSSD. In laundry department, in the calendaring area, uh, needle stick injuries are there because if any needles get stuck into the bed sheets, linens of the patients, and if the laundry staffs are not careful about it, they may get needle stick injury, and it may lead to bloodborne diseases and risk of infection if the linens are not disinfected or decontaminated properly, risk of infection and heat stroke. Okay, heat stroke can happen in the laundry department as well, where the drying takes place, calendering and drying takes place. That area of the laundry department is the temperature is very high. Okay, so employees who are working there continuously, they may get a heat stress or a heat stroke. So they have to be very careful. They have to in between at every 1 hour at least, they have to move out of the laundry department, out of the calendaring department, go out in the fresh air, get some cold drink. Always have some cold drinks to have, or cold presses, cold boxes, ice boxes should be kept in the laundry department. If at all any employee feels that dizziness, they can be well rested and accommodated. Then radiation hazards. So in like radiation hazards, if lead aprons are not worn properly, if pregnant staffs are or fertile women are posted in the radiation department, okay, that could also lead to radiation hazards. Okay, infertility among the female staffs as well as male staffs. Also, if they don't regularly use the lead apron, if they don't regularly use their dosimeter. Okay, dosimeter is used to check what is the amount of radiation that a staff has been exposed to for 3 months continuously. Okay, so there are numerous radiation hazards, ionizing as well as non-ionizing radiation hazards can take place. Okay, especially if the hospital has a nuclear medicine department, uh, radiotherapy department as well. Linacs are present in the hospital. There are high risk of radiation hazards for the working staff there. So use lead apron, use the personal protective equipment, etc. 1 second. Yeah. So wear lead aprons, wear personal protective equipments. Okay, be behind the lead door. If you're the technicians or you're the staff, always be behind the lead door if the radiation is ongoing. Bloodborne pathogens, HIV, AIDS, um, hepatitis B, hepatitis C. Okay, these all are the bloodborne pathogens which can affect. the staffs as well through needle stick injuries. So be use all the universal precautions to prevent that. Needle safety practices should be followed. Do not recap the needles after you have done the administration of medication. Immediately discard the needle as it is. Recapping usually leads to needle stick injuries. As soon as the needle's work is done, immediately it has to be discarded into the shafts container, disinfected and discarded into the shafts container. So bloodborne pathogens can be eradicated. Bloodborne pathogens among as a occupational hazard is usually through needle stick injury or sharps injury. Dietary services in kitchen department, cuts, lacerations, hands getting by mistake it goes into the mixer or grinder and that leads to uh, lacerations, okay, amputations. If by mistake you cut the finger or part of body part, a knife fell on somebody or something like that, okay, so sharp injury very common in dietary department. Okay, if you are not careful with your gas cylinders, that could burst, that could lead to a fire hazard. Okay, again, if the if the employees are not checked regularly, they can spread any typhoid kind of conditions or diseases. If they carry, they are carriers of any infectious diseases, are being hired as a kitchen staff, that could lead to any outbreak, food poisoning. Okay, so these are all the hazards that can take place in dietary department. Kitchen department also gets very hot. The temperature rises very high in the kitchen department. So again, the employees who are working there continuously can undergo heat stroke, heat stress, okay, excessive sweating that could lead to dizziness. They may fatigue, they may faint. Then fire hazards. There are various ways in which fire hazards can take place because highly inflammable gases are also used in the hospital, in the healthcare departments and hospitals. So there is always a risk of fire hazard everywhere. Wherever inflammable substances are used, like spirit is used, spirit is highly inflammable. Oxygen, other gases used in the hospital, highly inflammable. Okay, clothes used, the gowns, cotton gowns, gauze pieces, cotton pieces. Okay, any electricity short circuit from the equipments, any wires that are broken or torn, that could lead to fire hazard. So every department in the hospital is always prone to fire hazards, from the boiler room till the administrative sector, anywhere. Then mechanical hazards, if like there was a situation in which in case where the patient was wearing something of metal and it was not detected properly and the patient was put into an MRI and it lead to a hazard, it led to a fatal hazard. Okay, so these kind of situations has to be avoided. So that's an example of mechanical hazard. If the MRI screening is going on, the technicians should not be wearing anything that is made up of metal at all. So in such cases, CT scan is done, not MRI scan. This is one example of mechanical hazards. Mechanical hazards can take place in any form wherever high-end equipments are used. Okay, any form of equipment is used, where that mechanical hazards can take place. Hazardous chemicals, specifically the chemicals that have undergone their expiration dates, okay, in laboratories like reagents, etc. Uh, Chemotherapy drugs, reagents, okay, these are generally considered as the hazardous chemicals, but some medications or disinfectants, after they have undergone their expiration dates, they become more hazardous. Then slip, trips, and falls, specifically when wet mopping is being done in the public areas of any hospital. If they are not putting up, if they are not putting up the signages that the floor is wet, okay, then it could lead to slip, trips, falls. It could lead to some serious injuries as well. Wherever housekeeping staffs are doing wet mopping, signages has to be put up that this area or the floor is wet, be careful. Okay, so like that you can prevent slip, trips, and falls. Patient falls are also very common in hospitals, so identify the patients who are already at risk of falls, like patients who have undergone any neurosurgery, head injury, head surgery, patients who have vertigo issues, and patients who have undergone inner ear surgeries, children. Okay, they all are old age people. Next is workplace violence. Am I audible to all? Is my screen visible? Is my screen visible? Am I audible to all? So workplace violence very common in hospitals. The rate of workplace violence is increasing. Violence against the staff, specifically doctors, nurses, who work in the emergency department, critical care department, okay, they are at higher risk of being the victim of workplace violences. So in these cases, make sure you have CCTV cameras everywhere. Okay, you have a proper way of addressing a bad news. The doctors and the nurses are trained well to how to address, how to empathetically address or give a bad news or declare a bad news to the surviving family. Okay, there should be a specific room. Make sure security guards are available in high risk areas where regular workplace violences are taking place. Do not keep the public washrooms in very isolated areas or in deep isolated areas. Laser plume is a gas that is released when laser is used during surgeries. In place of suture, laser is used. Okay, in surgeries. So laser plumes are the gas that is been released when the skin is been burnt. Okay, so this gas accumulates in the operation theater and it can irritate the staff as well. The staffs who are inhaling this laser plume, they also undergo a risk of respiratory distress. So that's another occupational hazard. So make sure wherever the laser plume is being used, specifically the operation theaters, filter air ventilation and HEPA filters are in place. Proper air ventilation, exhaust fans are kept so that it can suck out all the laser plumes out of the OT and into it can filter it out and release it into the environment so that these plumes won't stay long in the OT complex and it will not be harmful to the staffs who are part of the surgery. Sharps containers, make sure that it is leak proof, puncture proof, sturdy container, and and when you are filling it up with needles or sharps, it should not be filled up more than 3/4. Okay. As soon as the 3/4 of the container is filled with needles or sharps, it has to be emptied, discarded, cleaned properly, disinfected properly, and put some disinfection solution into it and restart filling it up with needles and solutions. Okay. Don't keep the containers till it is completely full and overflowing of needles, because that is hazardous to the biomedical waste handlers. Equipment hazards, as I mentioned, if the maintenance is not done properly, preventive maintenance or breakdown maintenance is not done properly for the equipments, it can turn into hazardous. It can give some sort of electric current shock to the users. Okay. And sometimes the equipments may fail, and it is not able to save the life of the patients in critical condition. So that is also another form of equipment hazard. For example, if code blue is going on and the defibrillator is not working, okay, somebody forgot to check if it is a working defibrillator or not, and it is not working, you may lose the patient. Okay. So this is how equipment hazards work. Latex and allergies, make sure that the patients or the doctors who are handling the cases are also not allergic to latex. Otherwise, if you forego this step and if it turns out the patient is allergic to latex, it can cause more harm than good during the surgery. It can lead to a series of inflammatory and allergic reactions that can affect the prognosis of the patient as well. Heat stress, as I mentioned, in the kitchen department, boiler rooms, kitchen department, laundry rooms. Okay, these are the areas where there is a high potential of staff suffering from heat stress. So make sure a refrigerator is available, a freezer is with freezer, so ice packs are there, cold drinks, cold water, a filter with cold water is provided for the staffs, so they can. Charger outside. To make sure that the employees can have some cold drinks in between, and every 1 hour let the employee go out and take the fresh air, take the cool air from outside, so that they don't feel heat stress, and keep an eye out for symptoms of heat stress of in patients. If you see a patient sweating profusely and they're dizzy, they're feeling dizzy, they're getting fatigued, okay, the skin color has changed into deep red or pinkish hue. Okay, so these are the signs of heat stress. Identify these signs immediately and ask the patient to take rest, give them some cold drinks, something cold, uh, put them under the fan in the open area under near to the fan. So like that you have to manage heat stress cases. Morgue formaldehyde, inhaling too much of formaldehyde could lead to some health hazards. Slips, trips, falls, and morgue also is an area where it is quite isolated. Morgue areas, mortuaries are quite isolated in the hospital healthcare scenario. So any physical violence, sexual violence can also take place in these areas. Okay, not much public will usually go to these parts of the hospital. Okay, so it's quite isolated. So any form of staff violence, physical violence, sexual violence can take place. So always make sure CCTV camera is functioning at morgue. The staffs working in the morgue are not undergoing distress because of inhaling formaldehyde fumes. Okay. Workplace stress, make sure you have a counselor in your workplace. Good activities, refreshment rooms, group activity rooms. Okay, area where the staffs can come out and chill during their break time. Okay, staff friendly policies, guidelines, and rules, okay, should be put into place, so this can manage the workplace stress. Terrorism, we do not have a protocol for terrorism except for the black code. Usually in hospitals, you declare the black code black, if there is a terror threat. Okay, and here The staffs have to just wait for the law enforcement to act. Okay, in case of terrorism, it's a law enforcement. The only duty of the hospital administration and the in charges is that they have to inform the law enforcement about code black, and rest will be taken care by the law enforcement. Make sure the news is not spread to the patients so that you don't have to deal with agitated patients. You have to keep the patients, visitors, patient family as calm and cool as possible under such situation. Workplace behaviors like tics and knuckle breaking, biting the nails, okay, ADHD. Okay, these are workplace behavior because of which it could be quite distracting to other fellow workers as well. So these behaviors has to be identified: lethargy, lack of interest in work, impulsiveness, okay, aggression, unnecessary aggressions. These kind of behaviors should be identified in the staff. Give them counseling whenever provided. Give them a day off or leave if it is required to calm down, cool down, and then join back the work. So these are some briefing and examples of occupational hazards that happen in hospitals. If you have any queries, you can mention in the chat.